Hello, good afternoon all. I am Dr. Preetam Kadam. I am breast surgeon at KEM Hospital, Pune. Today we will be discussing few facts and myths regarding breast cancer. Breast cancer in India has become one of the commonest cancers in females. So 1 in 28% of Indian women are likely to develop breast cancer during their lifetime. It is more common in urban population as compared to rural population. In urban population, 1 in 22, and in rural population, 1 in 60 females have a chance of developing breast cancer during their lifetime. Over the years, more than 50% of breast cancer patients that are diagnosed in India are in stage 3 and stage 4. So, in India, one woman every 4 minutes is diagnosed with breast cancer, and around 30 women dies per minute due to breast cancers. So now we will see the causes for breast cancer. First of all, most important thing, if you have a family history of breast cancer, then you should be worry about that. Second is genetic mutation. Third is late childbearing. Fourth, early menarche and late menopause. Fourth is increased breast density and inadvertent consumption of oral contraceptive pills, hormonal replacement therapy after menopause, and last and not the least, obesity along with excessive alcohol intake and excessive smoking. So first of all, we will see the symptoms. Lump anywhere in the breast and axilla can be an ominous sign for breast cancer. Second is blood stained discharge through the nipple can also be a dangerous sign. So for that, every female should undergo self breast examination. We will discuss that in detail, how self breast examination can be done. So for the diagnosis of breast cancer, first thing, every female should do self breast examination. If she finds any abnormal lump or any swelling in her breast or axilla, she should immediately contact her doctor, then get properly investigated. On contacting the doctor, if your consulting doctor feels that there is a lump, then he will advise you sonomammography. Along with that, if that is sonomammography is suggestive of breast cancer or a benign breast lump, then he will advise you a fine needle aspiration cytology, or second thing, true cut biopsy, which will help us to arrive at the diagnosis whether your lump is cancerous or non-cancerous. So now we will see ways to reduce the chances of CA breast. First is don't smoke, avoid alcohol, limit your weight, reduce your obesity and lifestyle changes. Avoid exposure to inadvertent radiation. So criteria for screening of breast cancer is like every woman who is not a high risk candidate can go for annual mammography starting from the age of 45. Females after that is more than 55 years of age should undergo mammography every 2 years. For females who have a strong family history or genetic mutations should undergo sonomammography starting from the age of 25. So breast cancer, as compared to the Western countries, cancers are diagnosed in the early stages, but in India, whatever patients we get, those are generally stage 3 or stage 4 patients. So screening of the patients is the most important aspect in diagnosing and management of breast cancer. So management requires a multidisciplinary approach which includes surgery. For example, in surgery we have mastectomy, breast conservation surgery, along with that axillary node dissection, modified radical mastectomy, and if at all a patient needs, we can do breast reconstruction, followed by chemotherapy, radiation, and in some cases hormonal therapy such as selective estrogen receptor modulators, aromatase inhibitors. These all medications can be used as hormonal replacement, hormonal therapy for breast cancer. So the take home message is, do your self breast examination regularly. If you notice any dimpling or change in the size of any breast, any blood stained nipple discharge, or puckering of nipple skin or nipple retraction, immediately consult your doctor and get yourself evaluated. Thank you.